NURS 252 Pathology, Session 2, Cell Injury and Adaptation. Welcome to your second session in pathology. The goal of this session is to introduce you to the cellular basis of disease causation. You were introduced to the concept of homeostasis in previous session in physiology. We will now show you how factors that alter the steady state results in cell injury and causes disease. You will be practicing definitions and terms, listing examples, and providing explanations of the terms we will meet in this session. By the end of this session, you should be able to explain the concept of homeostasis and the steady state, and how alteration in the steady state will cause disease. Discuss the causes and mechanisms of cell injury. State the types and consequences of sublethal injury to cells, and explain the morphologic and other findings and the mechanisms by which cells adapt to injury. The key topics that will be covered in these sections are cellular basis of disease concept, cell injury, cell adaptation. And the recommended written material is still chapter 1 of the pathology basis of disease by Robbins and Cotran. So the first topic is cellular basis of disease concept. Virtually all forms of disease reflects organ injury that start with molecular changes, then cellular changes, and it is the cellular changes that manifest as disease. This is a concept that was brought by Virchow, the father of pathology. So you have already learned that cells are restricted to a narrow range of function and structure under the concept of homeostasis and the steady state concept. This is due to the genetic programs of the cell. And the cell in good health adjusts constantly to stresses and is able to maintain structure and function within these constraints. Homeostasis is this narrow range of the cellular responses that are termed normal. The stimuli that stimulate this are physiologic. The normal cell thus exists in a steady state. However, when stimuli of greater intensity and duration impinge on the cell, it may fail to maintain homeostasis. And that alteration will be reflected by molecular, biochemical, physiologic, and structural changes. So the response of cells to the adverse stimuli depends on extracellular and intracellular environments of the cell, the pattern and level of metabolic activity of the cell, the level of differentiation, and the genomic expression of the cell. Injurious stimuli vary in intensity and from extremely subtle to extremely severe. Depending on the nature, intensity, and duration of the injurious stimulus, the following may occur. 1. Adaptation. 2. Reversible injury. 3. Irreversible injury. This diagram shows how a normal cell in homeostasis may move to an adaptation state. If the stress continues, then it will go to injury stage. And if the stress is also very injurious to begin with, it will go straight to injury state without the phase of adaptation. And then eventually the cell may go into irreversible injury and death. So what is cell injury? This is the result of a series of events that occur when adaptation is not possible and the cell fails to adapt or the adaptation limits are exceeded. It will lead to alteration in the cell structure and function. The basic types of cell injury are reversible and irreversible. Reversible injury means that the structural changes and the loss of function occur, but repair mechanisms bring the cell back if they are successful. An irreversible injury means the cell is irreversibly damaged and will die. So this is another diagram to show how a cell may move to adapted state, return to normal, may move to an injured state which is reversible and return to normal. But when it moves to the irreversible injured state, it can only become a dead cell. And it also shows the two main types of cell death that we shall discuss later in other sessions. So what are the causes of cell injury? First is lack of oxygen. There are two ways that can occur. Hypoxia is when you lack oxygen only. Ischemia is when you block the vessel, so you may lack oxygen plus other things. Then physical agents. These are extremes of temperature. As an example, can cause injury. Then mechanical trauma. When you apply mechanical forces to any part of the body, you can cause all kinds of injuries. Some of them are listed. Abrasion is when you tear the epidermis away, like you have friction of the skin, to stab wounds where you have produced an injury due to a pointed object. Radiation, X-rays, gamma rays, alpha and beta particles, they can all cause injury. The damage is usually to the DNA, and cell injury occurs. Then pressure from, say, explosions can cause injury. Electric currents can provide a shock that will destroy tissues and cause injury. Chemical agents include drugs, acid, alkali, and other chemicals in the environment. Some of them are organic, others are inorganic. They can damage or cause injury by direct action or indirect actions. Biological agents, infections. They are used to infections like viruses, bacteria, fungi, and protozoa, and helminths. They can cause damage by replicating or directly damaging the cells or producing toxins. Some of them even produce hypersensitivity reactions to cause the problem. Then hypersensitivity reactions themselves can be due to many agents. Nutritional imbalance. When there's deficiency either in calories, proteins, or minerals, you can have cell injury. Finally, genetic derangements. These are inherited or acquired mutations in genes that are important, and they can lead to injury and abnormal structure. What in the cell is the target for this injury? The cell has a nucleus, cell membrane, cytoplasm. They are all targets of injury. The nucleus, for instance, has DNA that can be damaged by radiation and chemicals and free radicals. Cell membrane can be damaged mechanically, such as when you cut something, you have damage to the cell membrane. The cytosol, when you have deficiencies, or lack of oxygen can damage the cytosol. So what is it? What is the mechanism by which the cell is injured? 1, depletion of ATP. ATP is the main source of energy, the main way energy is used in the cell. So if you deplete ATP by not producing it or consuming it too much, you can damage the cell. Then mitochondrial damage, influx of calcium and loss of calcium homeostasis, accumulation of oxygen-derived free radicals, which is also called oxidative stress, that can lead to injury, and then defects in membrane permeability. So all these can damage the cell, and this diagram shows how the mechanisms lead to cell damage. So now let's come to the various types of injuries. Reversible injury. We have 2 examples of reversible injury to discuss. The first is hydropic change or cellular swelling. This is when the cell becomes swollen due to injury. When the cause of the injury is removed, the cell can return to normal, so it is reversible. Then fatty change. This is when the cell accumulates lipid within the cell, and the lipid forms vacuoles. Fatty change is seen in cells, for instance, the liver, when there is alcohol abuse, or when you consume carbon tetrachloride or phosphorus. Sometimes certain conditions like kwashiorkor, protein malnutrition, and diabetes, and obesity, starvation will show fatty change in the liver. When it is mild, there are no effects. But when it is severe, it can lead to death. The organ becomes enlarged and yellowish. And you can see from this picture the liver, one of which is showing fatty change, the one on the left, and then the normal liver by its side. Under the microscope, you see vacuoles in the cell, empty spaces within the cell. Now let's move on to cell adaptation. These are changes that occur in the cell when the injury allows it to adapt to a different state. And the various forms of adaptation are hypertrophy. This is the increase in the size of the cell due to an increase in its cell function. Hyperplasia is when there is an increase in the number of the cells, and also due to a stimulus that may tend to injure the organ. Metaplasia is when there is replacement of one type of tissue with another in response to an injury. And then atrophy is when there is a decrease in size and function of the cell. Now, there are other cell responses that may occur. We've dealt with one already: reversible, irreversible. There's also necrosis and apoptosis. And sometimes things may accumulate in the cells. But we want to focus on the adaptive. This diagram shows how cells may adapt. We have on the right side normal column, and then an injurious agent impinges. And they can either become smaller, that is atrophy, larger, that is hypertrophy, more by multiplication, that is hyperplasia. Or they may change and look different, that is metaplasia. Sometimes even their arrangement is altered, and that is called dysplasia. So, what is hyperplasia? This is the increase in size or volume of an organ or tissue due to increase in the number of the constituent cells. It may be physiological. This is when the breast, for instance, becomes enlarged in pregnancy, or compensatory. When you have removed part of the liver, the rest may become hyperplastic. And that's why people are able to donate part of their liver. It may also be pathologic. So pathologic hyperplasia is when you have excessive stimulation by hormones or growth factors. And example is prostatic hyperplasia in men. It is also a reversible process. In other words, if you remove the cause for the hyperplasia, it will go back to normal. Hyperplasia, which is pathologic, is a fertile soil for cancers to arise. So usually when they are found, they are removed from the body. Hypertrophy is increase in size of tissue or organ due to the increased size of the individual cells. So no new cells are added. It may also be physiological or pathological. Physiological, when you exercise and your muscles become thicker, that is hypertrophy. Pathological, when you have enlargement of an organ like the prostate. Both hyperplasia and hypertrophy, therefore, may be present. Example is the pregnant uterus. The muscle of the uterus becomes thicker and bigger, that's hypertrophy. And more cells are produced, that's hyperplasia. Atrophy is when there is decrease in size of the tissue or organ due to decrease in size or number of the cells, or both. So in atrophy, you affect the size of the cells and also the number of the cells. And usually, both are affected together. You may use atrophy as a term to apply to a single cell, in which case it will only decrease in size. Now, the reduction in the size is due to autophagy, a process by which the cell consumes its own elements within the cell. And then the cells may also die to reduce the number. That type of death is by apoptosis. And this may occur either as physiologic atrophy. The classic example is when, after the birth of a child, the uterus of the mother becomes smaller. Pathologic atrophy occurs as a result of many conditions. For instance, disuse. If you are immobilized, say due to a fracture, you will find that the limb, if it's the arms, you'll find the arm that was fractured and was put in POP will be smaller after a while compared to the one that was not put in plaster. It is because of disuse. Then if you lose nerves, your muscle atrophy. Example is polio. If you have reduction in blood supply, the kidney or skin may become atrophic and smaller. Then there's pressure atrophy, where something is pressurizing or pressing on a part of the body. There will be atrophy of that part. When you lack nutrition or hormones, you also can have atrophy. And then with aging, you have senile atrophy. The cells in an atrophic organ are smaller and they have autophagic vacuoles. And also a pigment called lipofuscin that collects due to digestion of the body's own organelles. And this lipofuscin may impart a brown color to the part. For instance, the heart in the elderly people becomes brownish and small. You call it brown atrophy of the heart. This picture illustrates atrophy of the brain. The one on the right is smaller, and the gaps between the parts of the brain called the gyri are bigger. So that is brain atrophy. Metaplasia is a reversible change in which one adult cell type is replaced by another. So it's also an adaptive change. If the cause is removed, then it will reverse. The example is squamous metaplasia in the trachea of someone who smokes. The cells there originally are columnar cells. They change to squamous cells. And the same thing can occur at the lower end of the esophagus, where squamous cells may change to glandular cells because of acid reflux. The glandular cells are better able to withstand the acid. So the squamous cells are altered into glandular cells. Metaplasia, when persistent, may induce a cancer. So when it is found, it's dealt with quickly. Otherwise, a cancer may result. Now, these metaplasia can also occur in mesenchymal tissues or connective tissue. So sometimes bone occurs in vessels. It may also occur in old scars or a place where there was healing in the past. That is osseous metaplasia. Chondroid metaplasia may occur at fracture site. When there's excess mobility, instead of bone forming at the fracture site, cartilage may result there. And then myeloid metaplasia occurs when in the spleen, liver, or lymph nodes, when you have bone marrow-like tissue growing in these places in certain situations. We call that extramedullary hemopoiesis. So you can now practice defining and listing the following. Hyperplasia, define. List causes of hyperplasia. Define hypertrophy. List causes of hypertrophy. Define atrophy. List causes of atrophy. Define metaplasia. List the causes of metaplasia. And you will find more material as reference in chapter 1 of the Robbins and Cotran Pathologic Basis of Disease.